Welcome to everyone. Happy New Year. It's wonderful to share information about the COVID vaccine on today's webinar with you. The impact of the COVID-19 pandemic has touched every life. We have witnessed communities become stronger and industries come together to work towards the greater goal of keeping individuals safe and healthy. And collectively, everyone's staying resilient over these last 10 months. We acknowledge these times are difficult. Every day, we are learning and adapting. That is our nature. Using our capacities as human beings, we can move forward each and every day. Over these last few months, I've personally learned not to long for the future or even the past, but to live today, to breathe, to be healthy today. The COVID-19 vaccine has brought us some hope. Our team has been working daily to learn about these vaccines, the science, the facts, and we like to take this hour to share some of these answers with your frequently asked questions. So let us introduce our team. Dr. Carrie Hone is one of our new functional medicine primary care physicians. She's been practicing medicine for 21 years and is certified in family medicine. Carrie, can you say hello?
Hello. Hello to everyone, and thanks for having me.
It's great to have you. And then Amanda Peregrine is one of our two new nurse practitioners. They have joined our Palm Functional Medicine Fellowship. Amanda has been working in our emergency room taking care of COVID-19 on the front lines. Amanda, will you say hello?
Hi, thanks so much for having me.
And Scott, many of you know, he's our functional medicine and primary care physician. He's board certified in internal medicine. Scott? Oh, Scott, do you want to say hello? We need you off mute.
There we go.
There we go.
Good afternoon. We'll get it. Thank you.
Thank you, Scott. So and I'm Sita Katie, I'm the Chief Medical Officer for Palm Health, and I work as a pediatrician and a neurologist. So before we dive into our webinar, I would like to acknowledge our medical providers and integrative medicine physicians who meet weekly and sometimes 2 to 3 times a week to stay current on this information. Every one of our team members contributed to this webinar, and any recommendations we make are from a collaborative team. So I'd like to take a moment to thank Doctors Varsha Rathod and Cynthia Kardesh, nurse practitioner Kristen Rinker, Dr. David Tribus, Jason Biondo, Emily Guilfoy, nurse practitioner Sarah Bird, Dr. Lily Liu, and Dr. Lauren Delfara, and our services director, Ashley Hartstein. Our collaboration as a team has been instrumental in the procedures and success that we've had at Palm in taking care of individuals in both preventing and treating those with COVID-19 illness. So we couldn't provide the care without our clinical team of nurses and medical assistants, our medical admin assistants, navigators, and guest services teams. So I'd like to get started with our webinar. And before I get started, just wanted to let you guys know that we did receive many questions ahead of time that we'll hope to address most of them. If you have any questions, please put them in the quick Q&A screen, and we'll try to answer them if time permits. So, Carrie, I'm gonna start with you. We have 2 available vaccines in the United States, one from Pfizer and one from Moderna. What is the difference between these 2? What are the primary differences and similarities?
So the major difference, the 2 manufacturers, first with Pfizer, it is recommended and approved by the FDA for those who are age 16 and over. It is given in a 2-shot series, 21 days apart. It's 94% effective. The Moderna vaccine, similar, is recommended for those 18 and over. It is given 28 days apart, 2 separate shots, and it is 94% effective. It's super important that if you get a vaccine, that they come from the same, each of those vaccines that you get should come from the same manufacturer. So if you start with Pfizer, you have to continue on with Pfizer. And we don't have a preference in the medical community. We're just encouraging all of our patients to get that vaccine that is available to them at the time. So either one.
Great. I think that that's really the big distinction, or the similarity is that they're both equally efficacious. So let's just get what we can. So Scott, both the Pfizer and Moderna vaccine are mRNA vaccines. And that's been something that is kind of new, both to the scientific community in terms of a vaccine. But what is an mRNA vaccine, and how is it different from some of the other vaccines that are in development for COVID, but even from like shingles or tetanus?
Yeah, so this mRNA technology is basically taking a genetic code, a sequence that programs the immune cells to respond to a certain protein. And it allows for a very amazing, precise ability to prime the immune system to prepare for this. As this slide shows graphically, you basically have identified in this coronavirus an important spike protein, which is very critical in how the virus gets into cells and propagates. By taking that mRNA sequence and putting it into this lipophilic package of delivery, it basically tells the immune system to reproduce and make all these copies of these spike proteins. Those then get recognized by the immune system, and the immune system becomes primed. It develops immune memory, so that if the spike proteins show up again in the form of a coronavirus infection, boom, the immune system's already primed and ready to go. One important thing to know about this process is this is really not as new as it seems in the media. The companies have been working on this platform for really more than a decade. It's been used looking for a vaccine for Ebola and a couple of other vaccine projects. So one of the ways this came up so quickly is that this platform already existed, was already in place. The important thing to remember also is that this mRNA that's delivered to the body through this vaccine, it's very quickly taken up, degraded. It does not stay in your system. It does not float. It basically gives this message, makes proteins, primes the antibody response in the immune system. And that compares with other vaccines that may have a modified live virus, or a virus has been kind of modified in a way that it can still reproduce but not cause disease, and that's a viral vector mechanism. And that's been out in the past, and basically, again, the same thing, priming the immune system. And then the other basic concept is ones where we take a protein that you can make in high enough quantities, you inject that in the body, and same thing, it then reacts to that and forms this immune memory. Some of the other vaccines that are coming out may wind up and are based on some of these other two processes, including a nasal spray that may be out sometime later this year. This mRNA model it's pretty dramatic, and as Carrie pointed out, this efficacy of 94% is, it's a fairly incredible, effective vaccine.
Oh, there we go. What I think is great about this mRNA vaccine is it is truly broken down so quickly that our own body is doing all the work after you've gotten the vaccine. We've broken it down, and then we're building that immune response. And so that's what I really like about this vaccine, and it is exciting. What, Amanda, is actually in the vaccine when you're being injected with it? What are the components? What are the ingredients that we have in that vaccine?
We've actually listed for you, so you can see on this next slide down at the bottom the specific ingredients. But what's more, in layman's terms, it really has lipids, salts, and sugars. And those are all things that naturally occur within the body. It's an incredibly clean vaccine. And what's more important is what's not in it. On this next slide, you'll be able to look and see that there aren't any eggs, there's no preservatives, no formaldehyde, no aluminum, mercury, or thimerosal. So they've really done a remarkable job at making a clean vaccine.
Yes, I think it's really what's been nice to see is that we can have a lot of reassurances for those individuals who feel that they've reacted in the past to vaccines, as well as it's just a very clean vaccine. So I've been very excited about that as well. So, Carrie, I'm going to pose this question, which is a question that comes up, that has come up is, can you test positive for COVID disease if you've been vaccinated with the COVID vaccine?
So the answer, Sita, to that one is no. When you have, if you think you've had COVID infection or if you've been exposed, you get a viral test. And that's when they put the swab into your nose and they test for viral particles. Just having the vaccine does not cause you to test positive. So there will not be false positive results on the viral test. So the answer to that question is no. The big thing to note, though, is that there's also an antibody test, and the antibody test tests for antibodies in your system. So a lot of our patients have requested that they get an antibody test. You may test positive on an antibody test after either having the disease, the infection, or after having the vaccine. So there's a differentiation between the viral test and the antibody test. So no, you won't test positive on the viral test, but you may test positive on an antibody test. So should not be any confusion.
Great. And I know that we're moving really quickly through these questions, and I think it's because we have so many. And so I think we're doing a really great job. And we're just going to try to hit as many questions as possible. Some of the questions that have come up in the Q&A, we will be answering throughout the webinar. So I will get to those questions. So please keep on submitting any questions that you have. The COVID vaccine has had a lot of questions about safety. And so, Scott, I'd really like to address this question head on, which has been in the media and the news, which is, I'm worried that the vaccine was created and tested in a short time window. And were the necessary safety precautions used that are normally used for vaccine safety as it was rolled out? So if you could please address that, that would be really helpful.
Yeah, it's an important question, and it's a concern that those of us in the medical community have had. I think the things to remember is that, particularly with the mRNA model, this was a platform of production and development that was already in place, and this technology lends itself very quickly to pulling up a unique new mRNA, putting it into the existing platform, and generating this vaccine very, very quickly. So this really reflects, more than a decade of experience with this platform. Secondarily, this was such a unique and overwhelming problem that it brought together a compilation of money and scientists and emergency-based need that we really put things into place in such a way that these studies were put together, generated with just never seen kind of light speed, if you will. But it turns out that in the final analysis, each of these vaccines has gone through, phase 1, phase 2, phase 3 protocols. There have been no evidence of any withdrawal of any safety net for the use or the monitoring of any of these vaccines. They are continuing to be monitored as we now go from the clinical trials to giving millions of doses. There's an ongoing evaluation, risk, reactions, that type of thing. Both of these studies had in their original clinical trials greater than 30 to 36,000 people. And now we're, giving 2 to 3 million more doses. So we've not found anything, even with a pretty skeptical eye, anything to suggest that there were corners cut, shortcuts made, and I think it really speaks to the ingenuity of really an important social need and throwing a lot of money at the science that was already in place.
Yeah, and I think that one of the things that I also had remarked on is when we do these studies, it's really important to see how many numbers are in the studies. And when you have something like tetanus or some other kind of less common diseases, you need a large population to be able to show efficacy. We had thousands of people developing COVID or being exposed to COVID. So we were able to quickly show whether, with numbers, how quickly we were able to show that efficacy. So I think that was the other thing that we really had the numbers in these. So thanks for addressing that. And so, yes, all the safety precautions happen, and we're still noting those side effects. And so I'd like Amanda to really go through what she herself has gotten a vaccine. What are the common side effects? What should people expect? And should anyone be worried?
Vaccine side effects are common, but they're not really anything to fear. They're a normal part of the body's reaction to the vaccine, and actually a sign that your body is building antibodies to protect itself. They're typically mild to moderate, and they start within a day or two of the vaccination, and they usually last for just a few days. Most commonly, what we're seeing is arm pain or swelling of the injection site. And then a little less common, but still out there for some, is fever, chills, tiredness, and headache. Now, knowing that side effects that can occur, they've made recommendations that if you have the ability to receive the shot on a day where you don't have to work the following day, they're recommending that you do so. I will say that I personally received my vaccines 1 and 2 on days that I worked, and I worked the subsequent days and didn't have any problem with that at all. So I wouldn't hesitate or tell someone that if they are going to be working that they shouldn't receive their vaccine. I say that if you have the opportunity to get it, do so. But if you also have the opportunity to schedule it on the day that you're not going to be working the following day, that's just an extra opportunity to give yourself some time off. Other thing to keep in mind is that although side effects are common and may mimic a viral infection, it's important to note that you cannot catch COVID from the vaccine. It doesn't have any actual virus in it. And so even though you may feel like you have the flu or feel like you have a mild case of COVID, it's not actually truly a COVID infection. Another thing that seems to come up in questions are people asking whether or not there's more or less side effects with one vaccine versus the other. And I don't think that there's really been any documented evidence that suggests that one is less than the other. They're about the same.
Yeah, I agree. And I know that was one of the questions that came up, and, we may find out as we get more and more information as time goes on, but I don't see that there's been a big difference or a delineation between those two different vaccines that are currently approved for the FDA. So because we know that we will likely have some side effect, whether it's minor or a little bit more, what would you recommend to try to prevent any side effects? Is there anything that we could be doing to prevent those side effects?
Truthfully, the immune response and inflammation that occur after you receive a vaccine are beneficial. So routine use of antioxidants or immune modulators really aren't necessary. In general, should they occur when it comes to side effects, it's very similar to with other vaccines. If you have soreness at your arm site, you're welcome to place a warm compress on it. If you are feeling achy or have a headache or chills, something like Tylenol or Advil can be really helpful. You just want to make sure you eat a little something when you take Advil so it doesn't upset your stomach.
Yes, absolutely. I got my second dose of vaccine yesterday, and I just took a little bit of a leave this morning as well to just decrease the arm pain, and I've been feeling really well, pretty good today. So I think that a lot of people have various effects to it, and I think that most of them are very, very mild. So I wanted to turn now from the actual vaccine to the distribution of vaccine, and I know that's a very common question is how am I going to get vaccine? How am I going to get vaccinated? Who determines that? Where can I go? And I wanted to really walk people through what that process is from a federal to a state level. And that's really important. So I'm going to turn to a slide. And if you just give me a moment, I will get our slide deck here going. So it's really important to remember that our distribution is regulated at both the federal and state level. So what that means is that not only is the federal government helping to determine what phases we should be vaccinating, they're then allowing the states to do further analysis of exactly how they want to distribute to the individuals in the state. So the slide that I have here is for the state of Missouri. It's similar to other states, and I know we have people listening from California, Florida, Arizona, and so I encourage everyone to go to their state Department of Health state website to determine exactly which tier they fall into. But they are very similar from state to state. So some of the general concepts will be able to pertain to each individual. And so I wanted to also let you know that each phase is going to take weeks to months. And I know this is really hard because everyone's eager to get their vaccine, and it's just what we are humanly capable of doing and being able to distribute. Everyone knows that we will try to get it to you as soon as possible, but we had to take some priority levels at a federal and state level so that we can get everyone vaccinated. Allocations are happening at a federal level. States will then receive the shipments weekly. And then the states, in fact, sometimes don't know what they're going to get that week. And then each individual site, so pharmacies, Palm Health, for instance, we have to place our order, and if there's allocation, then will we receive vaccine. So there's a lot of layers to this complicated structure, and that's what's important to get at. And it's important that the state of Missouri is really working on equitable distribution. They're trying to ensure that every zip code is vaccinated. And so currently, over 90% of zip codes in the state of Missouri have received vaccine in some format for phase 1A. I think that's important to note because there has been concern that only certain locations and only certain zip codes are getting that vaccine. So where we are right now, we are really in that phase 1A, and we're truly in just these two boxes here. And this box of healthcare workers, even these are particularly hospital-based healthcare workers. So small clinics, clinics that are not directly associated with a hospital, those healthcare workers have yet to receive vaccine. And that just was announced yesterday by institutions to have the ability to get healthcare workers that are in pharmacies, that are in small primary care offices, their healthcare workers vaccines, and then also our EMS and our first responders. So going into phase 1B, which is where a lot of our membership base is, this is where you may fall into, and this is how it's being rolled out. So phase 1B is in tiers, and I'm going to turn ourselves to really face this tier 2 phase, which is anyone that is 65 and older. And this is where some states are distinguished. There are some states that have elected to start in phase 1A doing 75 and up. And so I know that that's the case in Arizona and some other states. And so again, that's where these distinctions are happening. And Missouri may adopt that, but right now they're adopting 65 and older in this phase 1B tier 2. And then any adults that's 18 and older who have a chronic illness such as cancer, kidney disease, lung diseases such as COPD, heart conditions, weakened immune response, severe obesity, pregnancy is here, we will talk about that, sickle cell disease, and type 2 diabetes. Intellectual disabilities or developmental disabilities such as Down syndrome also is part of this tier. Then the next tier, which I think is important to note, these are individuals who are really here for societal function, for essential functions, such as education, childcare, communications, the food and agriculture departments. These are all very important places. One resource to look for Missouri, and every state has its own. This is from the Department of Health for Missouri website that has this information of which tiers are up and who's being vaccinated currently. So right now, again, we are in phase 1A and will likely be in phase 1A for at least a couple more weeks and then moving into phase 1B. So I'd like to, now that we're thinking about these phase 1B and starting to prepare for phase 1B, I'd like to turn towards to Carrie to help us really understand, if you are in phase 1B, should you get the vaccine? And one of the questions that comes up is, if I've already had COVID, should I get the vaccine? Would it be worthwhile to get antibody testing first and then determine whether I need the COVID vaccine? So Carrie, do you mind answering that question?
Sure. And I want to start by saying that this data changes every day. Every day I wake up and there is something new. And that's a testament to how much research is going on globally. So while a lot is not known, there's so much being discovered. So the answer is, if you have actually been diagnosed with COVID in the past, you should still have the COVID vaccine. That is the bottom line. And the reason is, when you get the infection, you develop, if your immune system is healthy, you develop an immune response. You make antibodies. And we don't know how long those antibodies last. In our own practice, we have retested patients and we noticed that those antibodies are gone. There was a study outside of the United States, it was in the United Kingdom I saw yesterday, stating that they had evidence of individuals having immunity out until 5 months after infection. But what's interesting is that the immunity that they had was only 85% effective. And so for these reasons, and that's just one study, we need lots more studies, but for these reasons, it's recommended that this natural immunity that you get from having the infection be boosted by the immunity that you get from having the vaccination. So we are recommending that even if you've had COVID, you get the vaccine. And we're not recommending antibody testing because it doesn't change the situation. Even if you have positive antibodies or have had positive antibodies in the past, it's still recommended to get that vaccination to, in addition to your natural immunity, boost your immunity and to protect you even more from the COVID viral infection.
Great, thank you. And before I turn to some other special cases, I just was looking through some of the cute questions that had come through, and I wanted to address those before we move on. One of the questions that I think was important to note, which is, I'm less than 65, but I have an autoimmune disease, and so you might be immunosuppressed. So you would fall into that phase 1B tier 2, because if you have a chronic illness that meet those criteria and you're between 18 and 64, you would fall into that criteria. Another question that had come through, which is, if I get the vaccine shot 1 in one state, but then have traveled to a second state in the time window that I need to get the second shot, will I be able to get it? The most important is that you have the same type of vaccine. So if you started with Moderna, we'd like you to get your second dose with Moderna. And so it can be tricky to move states. Practically, you can. We just would have to find locations that would be able to get you that vaccine. Vaccine is being allotted to states based upon phase 1, shot 1 and shot 2. So if a state has administered 1,000 phase shot 1, they're going to get 1,000 shot 2. So we're trying to keep things comparable. We prefer to everyone to stay put between their 2 vaccine doses, but that is one of the things that has come up as a question. Another question that has come up is, when will POM get the vaccine? And we'll be addressing that shortly. I want to go over the POM procedures in a little bit. So I would like to then now turn to some of the questions that we had prepared, which are, Scott, these special cases. You might fall into one of these phases, but you are particularly concerned. And one of the questions that comes up is, I currently have COVID-19 within the last week or even the last few days, but I have the opportunity to get vaccinated. Should I get vaccinated now? So could you address that? Or if I'm ill with any illness, should I get the vaccine now?
Yeah, and I think as Carrie pointed out, this database is changing pretty rapidly. But as of where we stand right now, the thought is that if you have documented COVID-19 and you're recovering well, you do have that honeymoon period of having that natural immunity. And so the recommendations come out to wait, around 3 months. And that's also because you're protected, but also to free up vaccine for other people who don't have that level of protection. So that's kind of the standard that we're working on right now. If you're 2 months out and you have an opportunity to get it, then I think that's probably not unreasonable to go ahead and get it. If you've got a virus, and we have to remember this is the time of year we do see other viruses other than COVID, we want you to be pretty healthy. We want you to be a week or two and probably 2 to 3 weeks recovered and symptoms resolved, and kind of give your immune system that opportunity to get back in line before you throw in another challenge with this vaccine.
Great, yes. And then what happens if you're immunocompromised? What would you do?
Yeah, so that's a broad range of things. There are people with mild autoimmune disorders that I think there should be no doubt or concern whatsoever. People who maybe are on chemotherapy or some more aggressive treatment protocol that has resulted in immunocompromised state, HIV, so forth, that probably needs to be dealt with on a case-by-case basis with the treating oncologist, the treating infectious disease person. But basic, well-controlled, under control autoimmune disorders, I think we're in good shape to just go ahead and proceed on with the vaccination.
And we have a lot of patients, particularly at Palm, with mast cell activation syndrome. And so I know that our mast cell patients are particularly interested in our opinion about the vaccine and what they should be doing and whether they should be getting it.
Yeah, and it is again, if you're on the mast cell blog or board where all of us discuss this, it is a point of discussion and interest. The current thinking, as best I can put together, is that if you have mast cell activation syndrome, which for those who don't know what that is, it's a syndrome where your mast cell component to your immune system sort of switches turned on and doesn't turn off. The thinking at this point is that if your mast cell activation syndrome is fairly well controlled with appropriate therapies, there may be a slight increased risk of taking this vaccine, but as I see it, the risk of not taking it and getting COVID in a mast cell patient is greater than that risk from the vaccine. So it is a calculated recommendation, but the way COVID works in the body, my feeling is that it's very reasonable and appropriate to go ahead and vaccinate our mast cell patients.
Great, I agree. Amanda, do you want to speak to pregnancy? If you're pregnant, what are the recommendations right now?
Yes, currently the recommendation is to get the vaccine. Pregnancy is considered a high-risk medical condition in relation to COVID. ACOG, or the American College of Obstetrics and Gynecology, supports the use of the COVID vaccine in pregnancy. But they do encourage pregnant women to discuss this with their own OBGYN if they have any specific questions or concerns.
And can you speak to breastfeeding and lactation?
The biggest recommendation when it comes to breastfeeding and lactation is that vaccine shouldn't be withheld just because you're breastfeeding. You can absolutely still get the vaccine as long as you're within that criteria group.
And I think what's good to remember is the vaccine, remember the mRNA is degraded so quickly. So I think that agreed that it is probably not any harm in lactating women. And then how about children? I know this has been always a topic because the discrepancies between what's been FDA approved versus what's distribution. So can you speak a little bit to the children?
Absolutely. So currently children are not able to get the vaccine as it's not FDA approved for those under the age of 16 for Pfizer, technically 18 for Moderna. However, it's not been distributed on a widespread scale for those under the age of 18. There are studies ongoing currently to look at those age groups and make sure that they're safe before they roll them out, and that probably will be coming, although we don't have a date for that.
Yeah, I think that that's what's important is they have started enrolling those 12 and older into the vaccine trials so that we can get that data. And things are changing. So as we move into phase 2 and 3, we may see that children might be able to get the vaccine. And again, as we experienced with the beginning of the COVID pandemic, information is always an evolution, and that's science, and that's what we expect. So it's not uncommon for us to get more information and to change, and also to see what our resources are. So I do think that we'll see that change over time as we get more information and we get those children vaccinated in the studies. So another question that comes up, Amanda, is the individuals who've had a previous reaction to a vaccine, what should they be doing? Should they not get the vaccine? Could they be doing something different?
In general, if you've had an anaphylactic, severe, life-threatening reaction to a vaccine in the past, we do want you to discuss that with your physician. But as a whole, you should be good to get the vaccine. The COVID vaccine as an mRNA vaccine is just not the same. It's not built the same. Given its structure is different from other vaccines, there's really nothing to suggest that a previous reaction would increase the risk of reaction to the COVID vaccine as a whole.
Yeah, and I think that that's what there are a lot of scares that can happen in the media that really throw everyone off on really understanding what the true vaccine risk for those types of side effects. And at the end of the day, we just need to turn to our physicians if you've ever had a severe reaction to anything, and to see if you should get a vaccine. And we would welcome those calls from our patients if they've ever had a severe reaction and they're wondering if they should get the vaccine. So, Carrie, I'd like to turn to the question that we've been getting, which is the vaccine. There's this new strain, and we're hearing more and more about this new strain that has originated and could be spreading faster than what we've seen in the strain that we've been known. Are we able to have efficacy towards preventing that strain with this vaccine that we're getting right now? So is the vaccine that we've been talking about effective against this new strain?
So that's a good question. And I would say again that things are changing all the time. So it looks like there's a strain from South Africa and a strain from the United Kingdom. And I was just scrolling through, and there's something about maybe a new strain originating in the United States. So I think we should expect that there are going to be other strains occurring. There was a study that I saw recently. It was a Pfizer study, and it was done in the laboratory. So with that new strain that was in the laboratory, they found that the vaccine, at least the Pfizer vaccine, was effective against the virus. So that gives us a little bit of hope that it might actually work in real life. It's just a glimmer of hope. So we're still in the discovery phases of that, but we hope so is the answer.
That's exactly so. And I think that the protein, the spike protein, that is the kind of common denominator, hopefully, between those two strains. And that's what we need to hope for. So I'd like to talk about St. Louis and Palm Health and how we're distributing vaccine. That's a lot of the questions that have come up in the chat window, as well as that we've been getting. And so I'd like to go over what our process is going to be at Palm, and so that you guys know what to anticipate. So Palm has become an approved vaccinator for the COVID vaccine from the Missouri Department of Health. We are waiting on allotments, and it's a very complicated algorithm that needs to happen for us to be able to get our allotment from the state, who gets it from the federal government. We will be vaccinating based upon the CDC and Missouri Department of Health guidelines. We are going to follow the same phases. We won't jump to another phase unless the state has jumped to that phase. So we are currently working on trying to get our employees as healthcare workers vaccinated. Then, depending on quantity allotted to Palm, and when we are able to get that vaccine shipped to us, we will prioritize. So if we only get, let's say, 50 vaccines, but we've asked for 200, we will have to prioritize based upon the same CDC guidelines for vaccination prioritization levels. So we would prioritize 75 and older, then we would prioritize 65 and older, as well as those that are adults that have had chronic illness. So one of the questions that came up were about hypertension and Parkinson's disease and other chronic illnesses. Those all do fall into the chronic illness designations, and we would vaccinate those individuals. So people who are seen by our medical doctors who have chronic illnesses, we are able to pull our reports of all the different diseases that we consider part of it, and we would send out emails. So it is important to note, if you have Medicare, you can still receive your vaccine at Palm. In general, if those who have Medicare have had to go elsewhere for their vaccines, but for the COVID vaccine, we are able to give it. And that's because COVID vaccine is free for everyone from a federal level. So somebody's paying for it, but we as individuals do not have to pay for it. And once our members have been vaccinated and we have additional supply, then we will open it up to family members. We are not using waiting lists. So in the past, there's been times where we've needed to use waiting lists. We will not be using waiting lists. So do not call to ask to be placed on a waiting list. You are in our system, and we will get to you and email you a request to set up your appointment for your vaccine. And vaccinations won't be drop-in. So when we do start vaccinating, they will be by appointment, and you will have to get a private link for that appointment based upon the criteria that you meet. If you know that we are vaccinating and individuals like your coworkers or friends in the community have received the link and you feel that you should be receiving the link, you will be given an email to email and let us know, and we can look into it to see if we can get you a spot. But we really do have pretty good records of every single person who is a member of Palm and what category they fit into. So please keep an eye on your email. I know for certain that we will not be receiving vaccine next week. We did not meet criteria to receive that vaccine. And the reason is Moderna, the minimum order is 100 doses. Pfizer's minimum order is 975 doses. So we are currently in phase 1A. We don't have 975 healthcare workers at Palm Health to vaccinate. So we weren't able to request the Pfizer vaccine, and the Moderna vaccine was not available for allotments. So every week we receive an email from the Department of Health that tells us which vaccines are available and what quantities do we need to we can order and what phase are we in. We have to take all that information and then decide whether we can order that vaccine. So I can tell you with certainty, next week we will not have any vaccine, but that will change every week, and it will depend on which phase we are in. So once we get into some of the phases that we have larger patient panels on, then may we be able to order that Pfizer vaccine of 975 doses. We are ready. So we have our committee for vaccination clinics ready. We've done large vaccination clinics before. We have the necessary temperature storage units. Those have been all validated by the Department of Health. We are approved. It's just a matter of getting the vaccine in our hands so that we can start vaccinating. And so we are very hopeful within the next 2 to 3 weeks as we move into phase 1B that we will be able to get that vaccine. And as soon as we have that vaccine, we are ready to go to send out those emails to those lists and to be able to get you guys your vaccine dose. So I hope that answers a lot of the questions that we had about the distribution of vaccines and how that's going to be working in particular to Palm Health and to you. So I'd like to, before we move on to some of the other questions that we had prepared, is to answer the questions that have come into the Q&A. So I think that one of the questions that has come up that I'd like to ask our panelists is, if someone has received vaccine, can they still be a carrier of that vaccine and transmit it to someone else that's not yet vaccinated? So I don't know who would like to take that. Scott, would you mind taking Carrie?
Yeah, so absolutely. So I think for now that these are still ongoing studies, there is some concern that even though these vaccines effectively block mild, moderate, severe illness, we don't know yet completely how effective it is in keeping someone from getting enough of a colonization or an infection, if you will, that could still be an asymptomatic spreader. So that data is obviously being looked at very aggressively, but I think this leads into one of the things that we want to point out is, even with this vaccine, even getting the vaccine, please don't think because you have the vaccine, you can let your guard down on masks, on social distancing, on some of these things. At some point, we're hoping to get there. But right now, even with the vaccine, because there are unknown questions and answers to some of these issues, we are going to still be very encouraging of everybody to maintain these safety protocols of mask and social distancing, and being aware that while we have all this great data coming out, there could be some nuances to these viruses that could still put people in harm's way. And as Carrie pointed out, if these viruses, as all viruses do, they mutate. And so if we do get a mutation that is disruptive to this vaccination benefit, we know that maintaining masks, maintaining social distance and appropriate social changes can prevent further significant spread of these viruses.
Great. And I think that one of the questions that have been coming up is, if you have waited longer than 28 days or 21 days for the vaccine, I don't know if Scott or Carrie, you feel comfortable, what should you do? So if you've had to wait longer than, let's say, 6 weeks and you still need your second dose, what happens and what should you do?
I can take that one. So sometimes it's reasonable. Suppose you're in between vaccination doses, maybe you get another viral illness. It isn't recommended that you get the vaccine during the time of a viral illness. So it might push back your second vaccine. So we want you to recover from that viral illness that you've had and get the second vaccine. So it's important that you get your vaccine as soon as possible after the time has elapsed between vaccines, the minimum time between vaccines, and as close to that minimum time as possible. And certainly each time you get a vaccine, you're given a vaccination card. So you want to hang on to that. It's recommended that you even take a picture of it so that it's really hard to lose, so that you have proof of your initial vaccine and that you can present for your second vaccine as soon as possible. And if you're not able to make it, then probably want to have some pretty good reasons for that. It's important to stay on schedule. But if you've missed that deadline, you should present again. And if you have questions, certainly speak to your healthcare provider. But it's really waiting that minimum time for your body to mount a response and then to get that second vaccination, the second boost.
And Carrie, I'm going to keep you online right now. There's a question about how long the vaccine immunity is projected to last. Could you speak to that? And, we spoke a little bit about the natural immunity. How long do you think that the vaccine immunity, do we know that question and answer?
I would answer this the way that I would answer my kids. And a couple of times during the COVID, my kids have said, "You guys are making this up as you go along, aren't you?" And the answer is kind of true. We are researching this as we go, and it is a tremendous effort across the globe to gather all of the information. So the longer we get into this, the more information we will have. So the information that we have is those first individuals who were vaccinated, and they will remain in those studies and continue to gather data so that we can see how long is the antibody response present and how effective is it. So that's something that we're figuring out as we go. And that's how science works. So don't be afraid, be patient. The data is coming and we have high hopes for it. I read something that it was projected long-term. I don't know how they made that projection, but at least, many months anyway. I don't know how they make that projection. Maybe it's an algorithm, I don't know. But we're waiting for more data.
Yeah, I think that's precisely right. We're all living through a science experiment right now, and I think it is fun. It's nerve-wracking, but it is fun, and I think it's important for us to see how this data is evolving over time. And I think that speaks to one of the questions that came up that I'll answer, which is, are scientists continuing to work on the COVID vaccine after emergency use approval and distribution and administration? And absolutely, all of those individuals that were part of that trial, like Carrie had said, are continuing to be part of those trials. There's continued efforts. We also, everyone, when you get your vaccine, can enroll in what's called vSafe, which is registering yourself as an individual to show what side effects you might have had or what your experience was. And that is all being followed, and so that we can really understand long-term and at kind of critical mass what information we have related to the vaccine. So that's definitely being addressed. I want to turn back to some of the distribution questions because I know that is really a large amount of questions that people have. And so yesterday Governor Parsons did for the state of Missouri announce that phase 1B tier 2 is being ready. That is honestly news to me. I am attending webinars from BJC, Missouri Baptist, the Department of Health on a near daily basis. And I have not received that information or how that's going to happen. It isn't to say that that's not true. It's just that information has not been distributed to individuals who are COVID vaccinators. So currently we are still on phase 1A, and there are a lot of individuals on phase 1A who have not been vaccinated, and we do need to remember and to give those individuals priority before we jump to phase 1B. And we are all anxious to get on to phase 1B, but we will need to wait for that. The next question is will Palm vaccinate former members? And again, like I said, we'll first prioritize our members and our patients, and then if we have allotments, we will open it up to family members of members and other individuals as we have allotments. We do want to take this mission through, and we are part of this mission of vaccinating and helping us develop that herd immunity. And so we will try to vaccinate as we have the resources to do that, every individual. And then what about patients who live in Illinois? So if you live in Illinois, but you are a member or a patient of Palm Health, you will be able to get vaccinated in Palm Health and in Missouri. So do not worry. If you live in Missouri and are not part of our network, you will have to look at your Illinois distribution and going to the Department of Health for Illinois. And then, so I'm going to turn the next question to Scott, which will address some of the other questions that have come up about masks. And so, Scott, do we still need to be wearing masks if we've been vaccinated? If we've all in a room have been vaccinated, should we be wearing masks? Those are some really pertinent questions. So can you please take that one for us?
Absolutely. And I think it's an easy one. And the answer is yes. We just don't have enough data with this. Even if you're hanging out with a group of people and everybody's had both vaccines, we just don't know yet what that means. And please, please just hang in there, keep wearing your mask, and keep being smart about this whole process. We've all been through this for 10, 11 months, and there's some light at the end of the tunnel, and we just got to stay with this. So until we get other data, we monitor this daily, other data, other recommendations, we really will encourage everyone to continue to wear masks regardless of vaccination status.
Yep, and I think that's a really good reminder, and that social distancing, the mask wearing, and to remember that our numbers are still going up, and we really do need herd immunity. We need to be vigilant, and we've only vaccinated a small minority of people right now. We have a long ways to go, and I know it's hard as a public individual in the public to want your vaccine and not feel like you have the control to be able to get that. And I hear you, and I wish we had other ways to get everyone vaccinated very quickly. And we're just where we are, and we're going to have to accept it and move forward on living each day, like I've been saying. So I'd like to just take a moment and let everyone of our panelists say one thing to leave us and get us on with our day in St. Louis. So Carrie, would you like to say one last remark that you want us to take home?
Just like to encourage everybody to be patient and think about when you're waiting for your vaccine, the person in the nursing home who is at high risk and has not received their vaccine. We want them to have it first. We want all the healthcare workers to have it so our healthcare system works. And I want you to feel confident that we have done everything we can as a PALM team, hours and hours and hours, the administration, CETA, all of the providers, on a daily basis, we have got our ears to the ground, and we feel confident that this is the way to go, that we want everyone to get vaccinated, that we ourselves, I've been vaccinated twice. I want my family to be vaccinated. I want my patients to be vaccinated. So hang in there, be patient, and be confident that we have researched this up one side and down the other, and we feel it's best for all of our patients.
Thanks, Carrie. And Amanda, would you like to say anything?
Absolutely. Thank you so much for having me. First and foremost, I'm really excited to meet everyone at PALM, to see members as we start seeing more people coming through, if I see you virtually or in person. And to reiterate what Carrie said, I really do just want to wrap up and say that I don't want anyone to feel like fear should overcome you when it comes to choosing whether or not to receive this vaccine. It is a hard decision, but I would very much encourage you to receive it. It's not something that should deter you. We know that this is something that is going to get us out of this, and you just got to be patient and have hope.
And Scott?
Yeah, again, wear your mask, follow all the protocols that we've got in place. And I think Asita pointed out, stay resilient, this has been also overwhelming in this whole big picture and continues to unfold daily. And if we can stay focused on today, on the beauty of each day and remain resilient, it really helps keep your spirit in the right place, but it really also helps your immune system stay in the right place. So stay focused, and there's things we don't know, and there may be things to come that we don't know, and we'll work on them as they come up. But here today, we've got a plan. We're moving forward. There is some light at the end of the tunnel. So stay focused today. Keep your nutrition up. Do your meditation. Work on those resilience factors. And just know that at PALM, we're trying our best to make sure we take the absolute best care as we move through this terrible process we've all been through.
Thank you, Scott. And I like to give a shout out to Amanda and Kristen, who are two nurse practitioners that have been instrumental in testing our patients who think that they might have COVID. And we have our wonderful outpost that we opened up in the back of PALM so that we can keep people safe. But if you do have symptoms of COVID and need to be tested, we are doing rapid COVID. We're doing COVID PCR testing, and Amanda and Kristen can see you and triage you as well. So don't forget that. And I do want everyone to just remember to take that moment to breathe and not hold on. And we really appreciate all of your support, and let's look for a really good 2021. And thank you guys so much for joining us, and look forward to the next webinar that we'll have in a couple of months. Thanks.